Hello, I am Dr. Priya Timothy, the Glaucoma Specialist at Zamindar Microsurgical Eye Centre, Kalyan Nagar, Bengaluru. Today I am going to speak about a test called the visual field test. Now the visual field test or perimetry is a test that measures your peripheral vision. Now we'll ask, what is the visual field? The visual field is the area that we can see above, below or to the side when we are focusing straight ahead. So there are various conditions in the eye and the brain where we need to assess the field of vision of a patient. The regular eye checkup that we do does not detect any visual field loss unless it is very obvious. The conditions where a visual field test becomes very important is when we need to find out if you have glaucoma or if you have some neurological problem. There could be a brain tumor, or it could be that you have had a stroke, or it could be that you have had an accident involving the brain or the eye. Visual field tests are also important because there are certain medications given for some diseases which could impact your visual field. Hence, it is important that we understand the necessity of doing a visual field test. The visual field test is important for the diagnosis and monitoring the progress of the disease and to check if the treatment has been successful and the visual field has improved. The most commonly done visual field test is called the Humphrey Field Analyser or the HFA. In this test, we check the various degrees of the visual field. We could check a 10-degree field, the central field, or a 30-degree field, or the peripheral field, which is 60 degrees. Before the field test is done, the patient's refraction and vision is confirmed so that the correct glasses can be used during the test. For this test, the patient is made to sit in front of a concave dome where there is a central target which the patient has to focus on. One eye is examined at a time and the other eye is covered. The patient is given a clicker button in his or her hand. Throughout the test, the patient has to focus on the bright central light and he or she will see small, bright, flickering lights appearing in the peripheral vision. The important thing is that the patient should not change their focus from the central target. You can always blink during the test. And in some cases, if you want to take a break, you just need to tell the examiner to stop the test. If you feel that you are not sure that you have seen the light, you can miss clicking the button. The visual field test can be quite a challenge, especially for the elderly who are not able to focus for long durations. This is not a problem at all. The patient can do one eye, the test one day and come back another day for the other eye. If the patient wants a break, we can always pause the test and they can have a break. At the end of the test, the computer generates a printout which the doctor assesses and the doctor can predict whether there has been a progression in the disease, whether the visual field has improved, and it is also very important in making a diagnosis of glaucoma. In conclusion, I'd like to say that it is really important that a visual field test is conducted, even though it requires a lot of patience.